We have a number of questions already from the public, which I'm excited to get to, but I also want to remind folks, you can put your questions here in Zoom, or if you're following us on Facebook, and we'll get as many as we can to the commissioner here during this hour. First, just one general important point. We're in phase one of the reopening. It started Monday, and you outlined some of the changes, some of the industries which have been allowed to reopen. Could you tell us how's phase one going from a business perspective at this point? What kind of challenges are you seeing for workers or consumers? And what I guess so far is, well, we're on day 3 so far of this new phase.
Mm-hmm. So it's still a little bit too early to tell, but I have to say that we are working very closely with the Small Business Services Office, right? The agency that has been really trying to educate businesses as much as possible and providing our businesses with face coverings and just the guidance that they need to make sure that they're keeping a safe and healthy work environment. We just launched a hotline through 311 because it's the number everyone knows. But if you call 311 and you say, I am a worker and have a question about my employment and what should I expect, we've been getting those calls since Monday. One thing I would say that is a little concerning is that workers are calling us and saying that they believe their employer's not following the guidelines, but they're very, very worried about giving their names and giving the employer's name or the name of the business for fear of retaliation. And you know, I'm sure you know, a lot of our immigrant workers are overly represented in the industries that are just opening up this week, like construction and retail and service industries. So I think that people are really desperate to go back to work. And I think we're going to see that this has to be an effort by everyone, right? It has to be consumers, workers, and employers, everyone on the same page, that together we have to make sure that these guidelines are complied with, or we all lose, right? We all lose if we don't follow these guidelines strictly. So I think the city is going to try to do some more proactive visits to businesses, really to just put emphasis on the education and, again, give them what they need to comply with the guidelines.
Excellent. So we have some questions coming in, but I want to get to them. So this one's actually anonymous, but it says, as a freelancer, can a company make you sign a waiver indemnifying them from all COVID liability? Can employment be withheld if you do not? Is this legal?
So I would say a couple of things. Typically, you cannot waive your rights that are in the statutes, right? They cannot be waived via a contract. So for instance, someone tells you to sign a piece of paper that says that you agree not to get paid minimum wage. That contract is not valid, it's illegal. The question here is that what type of issues are we talking about, right? Because a company or a firm, a business cannot make you waive your rights to public health, right? And a lot of the guidelines that are in place right now are for the public health protection. So even if you as a worker, as a freelancer, wouldn't be able to, let's say, force the employer to comply with the safety and health procedures, the government still can, right? So for me, it's technically, I cannot say for sure that legally these types of guidelines, which are new, right, and issued via executive orders, whether an individual can waive them, I don't believe that's possible. But I think that we would love to talk to you a little more in detail about what exactly that means, right? Because the employer may be seeking to protect themselves from, let's say, if they don't provide you with the safety equipment that you need, that then you cannot sue them in your own personal capacity. So I think we need to get more information, and maybe we can talk to, we have some of my colleagues here on the line who can share their contact information.
That's great. So, Commissioner, if one of your colleagues could put into the chat a way that folks who are participating could reach out to your office. Mm-hmm. And I'll also ask one of my staff members to do that for our office. And so if you feel like this discussion is not answering a very particular question that you have, then reach out for one-on-one help. We're always here, and the commissioner is generously making available their contact info as well. And eso lo voy a repetir en español. Si usted cree que esta discusión no le está realmente respondiendo a sus dudas personales, usted puede pedir ayuda, tanto de mi oficina, que vamos a poner todos los datos aquí en la charla, o de la comisionada que parece que acaban de poner el correo electrónico de ellos, que pueden también comunicarse con ella y con el comisionado. So, Commissioner, we have a question from Michael Marino, who's a well-known community leader in Lower East Side, asking about a situation where someone might live in the 5 boroughs but work outside, or I presume vice versa. And there's a lot of people in both of those categories. And so which of the phase 1 versus phase 2 rules should they be following? If I'm understanding the question correctly, if Michael's on now, he can clarify if I didn't get that right.
So, okay, so what I would say, so if you're working in New York State, right, the business is the one that is required to comply with those guidelines, right? So phase 1 in New York State, or in New York City specifically, right? Because different counties may be at different stages of the reopening, right? In New York State. But in New York City, businesses have to comply with only the phase 1 requirements, right? So if you come to work in New York City, you can go to work in the industries that are allowed to be working right now, and that's it. If you go to work in New Jersey may be at a different stage of reopening, right? And that is what applies there, right? So it's really about, is the business that has either the constraints or the requirements to operate, depending on the county they're in. So I would say that for you, again, it really matters where you're working, which state or which city. They'll be the ones who determine what phase they're at.
And remind us, so New York just got to phase 1. Westchester is now at phase 2 or not yet? We'll confirm that if you don't know. We'll try and get that into the chat. I'm just curious to know Long Island and Westchester, because so many people do live and work across those lines.
Yes, I'm not sure right now, so I don't want to give bad information.
No problem.
Definitely in New York State, there are some areas that are at phase 2 already.
We have an excellent question from Renee Peña, who's asking about a really difficult dilemma about going back to work if you don't have childcare. And, the childcare system is largely still closed. And that presents a terrible dilemma for parents. I wonder, Commissioner, if you could comment on that, and how can workers and parents navigate that?
Yes, that is definitely something that a lot of our New Yorkers are struggling with, right? As like the schools haven't reopened yet and people feel like they have to come back to work. I mean, New York City is encouraging employers to continue to provide accommodations for telecommuting, right? Because we really don't want everyone to come back to the office just yet. I would say there are certain provisions right now under federal law that anyone can look at, right? So, and even under state law, possibly family paid leave, or under federal law, under the CARES Act, there's some benefit that allows you to, if your schools are closed, to be able to participate in that benefit. Now, I think like Alberto or Claudia, who are on the line, might be able to provide links to those, government agencies, because it's not New York City that manages those benefits, right? But I think that before you despair too much, we can help you look into what the state or the federal benefits might be available to you.
But sorry, Commissioner, is an employer obligated to be accommodating? I mean, it would just be totally unjust if someone lost their job because your workplace was reopening, but you have nowhere for childcare. It's not your fault. The city hasn't opened childcare systems yet.
Yeah. Like I said, it's a difficult one. There are certain as you know, some essential workers, right? Essential workers who have already
At
been
the
working,
schools,
right?
right.
They have access to the schools. So it'll be good to know maybe what kind of industry this individual is employed in, right? Because we could potentially try to have a discussion with the employer and try to advocate for providing the flexibility that people need, right? So in reality, New York City has still been encouraging everyone to continue to work from home if possible. So we would love to see if we can be helpful. So again, for when it's a specific situation, I think if you don't mind reaching out to us and giving us your contact information, I forgot the name of the individual.
I think it was, I think that was Renee Pena.
Right.
And it looks like she's still on and she's going to reach out. So thank you for that.
Right.
So we had a question from Anya Brinson, which raises a really big topic. Security, safety, and precautions in place for workers when they're returning to the workplace. Mm-hmm. The pandemic's not over, folks. I know we're exhausted by this, but there really are still risks out there. We still have several hundred new cases a day. And we should probably talk more about that if we have time this hour. But for workers, they need protections. And I think anyone going back to work would have a right to ask whether precautions are being taken for them. And as a business owner, we need to offer guidance on what our city and our state expects of businesses, different kinds of businesses, whether it's retail or manufacturing, going to be different challenges and different solutions. Can you talk both, Commissioner, about the kinds of things that we're asking of our businesses to keep people safe? And what can an employee do if they feel like those rules actually aren't being followed?
Yeah. Thank you so much for that question. Like I said, we're really busy putting together all kinds of materials that are currently being translated into as many languages as possible so that everyone can get this information. But right now, employers are required to do a few things. And I know that Alberto is also texting this into the chat for the audience to look at. But basically, employers must post a safety plan that is visible to their employees, right? They must conduct daily employee health screenings. And for employers or small business owners who may be listening, the Department of Health is coming up with tools that employers and businesses can just download from their website and use that as a template, right? That they can, so they don't have to go and create a whole new thing. They have to give workers face coverings. So it's either the face coverings that are disposable and they have to get as many as needed, or the ones that are reusable, right? But just a couple of them at least so that people can wash them at home and use the new one the next day. They have to provide hygiene stations so workers can either wash their hands or have access to hand sanitizer. And they have to also make sure that there are signs posted so workers can keep at least 6 feet of distance between themselves if possible. And if it's not possible, there are some occupations where people have to work closer to each other. They always have to wear a face covering. They also have to require customers, if any of them are coming into the store just for pickup, right? Because right now, that's the only thing you can do in retail business. Go either curbside pickup or in the store pickup, right? Not browsing around. Customers must either wear a face covering or remain at least 6 feet apart from anyone else, right? So employers are responsible for doing all of that. And I would also add, if an employee gets sick, the employee must be able to go home and go home and stay home until they recover. And obviously employers are subject to paid sick leave laws that they have to comply with. Now, workers or customers, really, this is for all of us to take very seriously, right? Anyone who believes a business is not complying with these guidelines should call 311, and they can say they want to file a business reopening complaint. They can do that anonymously, and the city will spend the next couple of weeks simply educating the businesses. We know it's a lot of information. So we're going to come in, we're going to bring the face coverings they might need. We're going to bring them the examples of
So Commissioner, sorry, that's an important point because a number of businesses have asked me about this. Do you have a stockpile of PPE that you can make available? Is that for free? And I've had that specifically from doctors' offices too.
Yeah. So,
like small family doctors in our neighborhood.
so I am going to ask Alberto to post the link to the SBS site, because Small Business Services basically has partner with different bids in all areas of the city, so that the bids or industry associations are sort of the repository or the sites for picking up face coverings, right? So any business can go to one of these sites. There is a map on the website of SBS website where people can just see what's the site that is closest to them, and they can go pick up those face coverings. So I'm going to ask Alberto to post that on the chat. But if they have issues, like, just call 311 and say, I don't know, where to get masks. I don't know what to do with that. I want to get some. I want to protect my workers. 311 will also guide them and say, this is the closest site to you to pick up those face coverings.
I hope all our Zoom participants are following this chat, because Alberto from the commissioner's staff is on fire, posting a lot of really good stuff. So don't miss that. Very, very helpful.
And if people forget, if people don't see it, really, 311, they will be like directed to either Small Business Services information, or to our site, our hotline, if it's a worker that has any questions.
And Commissioner, we've had a couple questions on unemployment insurance, which I understand is a state issue, but because it's coming up, I just want to put it out there, and we can perhaps direct people to the right place. But we did have a question from Chilan Lu about applying for unemployment assistance, essentially as a freelancer. Seems to be her question. She was a substitute teacher at a private school. And then we had a question from Barbara Nelson, which is this is interesting, getting emails that are presumably from the Department of Labor in Albany about unemployment insurance, asking for personal ID and documents, though she's already mailed them to Albany, and wondering how she confirms if that might be spam. So I understand that this is not your portfolio, but if you have any thoughts, or can simply direct folks in this Zoom to the right place.
Yes, so I'm not sure Claudia Enriquez, who's one of the supervising attorneys in my office, is able to respond. I'm actually, you froze a little bit for me, so I didn't get the entire question, but I see her unmuting. So Claudia, can we guide? Hi, Claudia. This is Claudia.
Hi, everyone. Yeah, so under the federal law that was passed in response to coronavirus, freelance workers and independent contractors should be eligible for unemployment insurance benefits. So as to the first question, that person should still apply. As far as the second question about whether the document request is a valid one, it may be worth contacting the agency and just confirm that, do they follow up via paper. I have heard of a number of scams, unfortunately, entities taking advantage of this crisis. So I think where something seems suspicious, you would want to contact that agency directly and confirm that that is part of their protocol.
And I believe that there's actually a special link for like applications that may be incomplete and people need to complete them. So maybe Alberto, if you can find that link in our resources list. But yes, definitely be very, very careful about giving any of your personal information unless you fully confirm that this is the agency that you're speaking to, right? And they should be able to clarify with you what your claim number is, because you were given a claim whenever you filed for the unemployment insurance benefits. So if they don't have that claim number when they contact you, they might not be for real the agency.
Okay, we have a question from Nancy Rankin, who's a well-known policy expert at the Community Service Society. It's actually about some legislation. I don't know if you're prepared to say a word on it, but it's Intro 1797, which is a bill that would require Department of Consumer and Worker Protection to create posters for display at pharmacies and healthcare locations around the city to tell New Yorkers about their rights vis-a-vis paid sick leave. So that's a little bit in the weeds, but I think you understand why this is so important. Honestly, paid sick leave was always important, but in this environment, I mean, my goodness, it's probably one of the most critical policy protections we have. And as a health chair, I'll say that in order to stop the spread of the pandemic, we need people who are not feeling well at home. This New York idea that you just tough it out and go to work and you're just going to power through, that is not anything that we can do. It certainly not now because of the threat of spreading the virus in those conditions. People don't feel well, need to stay home. The problem is they need paid sick leave to do that. So do you want to speak on this idea of posting those rights in the kind of places people are going for healthcare and pharmacies?
Yeah, and I am familiar with the legislation, and I believe that we were supportive of it when there was, I believe there was a hearing on it. And so what I would say, I think that our feedback was that that we advised that it should be a requirement for the offices to actually post it. I know that there was some legal questions as to whether they could be required, but certainly I fully agree with you. And I think we're in a different place right now that even if we didn't require it, I think at this point we will get a lot of willingness from medical providers and doctors' offices to post this. As you said, it is a life-saving benefit.
It really is. It really is. And, you know, it's challenging with coronavirus because, first of all, it can be a very long-term sickness. You know, I had it and I was over it in 14 days. And that is the experience. Most people are done in 14 days. But there are cases where, I mean, my wife, it really took closer to 3 weeks, but there are people who are sick for a month. And there's even been some cases, thankfully this is not the norm, that have stretched into 2 months. And there's another challenge, which is that some employers are demanding a positive, confirmed diagnostic test. And for much of the last 3 months, it was very hard to get tests if you weren't sick enough to be in hospital. The supply has expanded, but even today, the turnaround time in a test, I mean, if you're lucky, it's 2 to 3 days. But there are times where it's 5 days to get a test result. Yeah. Meanwhile, is the employer going to require you to come into work? I mean, that would be dangerous. So specifically for coronavirus, how are we navigating these challenges in accessing paid sick leave?
Yeah, so as you might know, so New York City has had its paid sick leave law for the last 6 years or so.
Right.
But the state and the federal government finally acted in response to COVID-19 and granted some emergency paid sick leave benefits just a few weeks ago. I believe at the beginning of March and then at the beginning of April for the federal government. And so it is a little complicated for workers to figure out where to go to because the eligibility changes depending on the size of the employer, depending on sometimes even the annual earnings of the employer of the business. So, but I would say that under state law, you have access to even more days of leave, depending on the size of the employer again. And in many cases, even after the employer's obligation to pay you for your time ends, you can still seek access to paid family leave or disability benefits, right? Which are requirements that employer has to have that anyway. So it doesn't cost them anymore because it's like an insurance that they already purchased. But and people were having a lot of problem accessing the New York State paid sick leave law because of that same issue you just raised, that they were having a hard time getting an actual diagnosis of the illness. So New York City Department of Health actually issued a standing order of quarantine so that New Yorkers now, because they're having a hard time getting tested, right, or they could call the Department of Health and say, my doctor has said that he believes I may have the symptoms, right? But I either
Right.
don't have results from my test or haven't been able to get a test. And then the Department of Health will give them a form that they can now use to give to the employer, and the employer now can process
So this is really important because I wasn't aware of this. So if I'm coming down with coronavirus and either I haven't been able to get a test or I just haven't gotten the result back because of the delays, then a doctor can immediately fill out this form, and that serves as adequate proof. Is that right?
That, along with the Department of Health, like certification, right, or order that they issued, and it's a standing order that can be used.
Right.
For
No, I think I'm going to have an antibody test if I have to go back to work.
I'm sorry.
I think that was I think that was a little bit of interference there.
Oh, no problem. Yeah.
But I think I got a question out of there. I'll hit you with in a second.
Yeah. So definitely, just like now, you can have this use the standing order by the Department of Health, and I will find that link, or I'll have Alberto provide the link. And then you need a doctor's note, but now even that can be done remotely, right? So you don't even have to go to the doctor's office to get that. And with that information, your employer now has an obligation to give you the state paid sick leave law, which has we can cover many more days, right?
Right. So we are now starting, we actually started already, contact tracing in New York City about 10 days ago. And this is a critical public health infrastructure to protect us as we move to the next phase in fighting this virus, where the number of cases is down and it's actually possible to trace contacts and have people isolate and quarantine, so we can stop the chain of contamination. And that's going to require people who have the virus to isolate. That means stay home. And it's also going to require people who have been exposed, even if you're not yet sick, to quarantine for 14 days. That is how you stop the virus from spreading. But it raises a question for people who are working and can't telecommute, which is most people. Will paid sick leave cover someone who needs to quarantine, even if they're not yet sick? Because again, the idea of quarantining is you've been exposed, so you got to go home. And you may develop symptoms in a day or two. You may develop, you may get a positive test result at some point, but you're not supposed to wait for that because you could be out in the community spreading the virus in the meantime.
Yes.
How does paid sick leave apply in those cases, quarantine and isolating?
Yeah, so it certainly applies, right? So I would say first, for New York City paid sick leave law, it's considered preventive care. So you could use your leave under New York City law to just stay home, right? Even if you're not sick, but you have an order of self-quarantine. But the state and the federal law also apply. So what we recommend to workers is that they use first the benefit that they can, which is maybe the federal government, and then in addition to that, use the extra sick days a year that they can get under New York City law. But
Right.
that self-quarantine, that entitles workers for any of those benefits under city, state, or federal law.
Right. That's great to hear. I want to say that my belief is that paid sick leave is not enough for quarantining, partly because the city's law is only 5 days, and I just said it's 2 weeks. And also because, you may have already used up your 5 days. It's already the middle of the year and people get sick. I really think we have to offer some sort of financial incentive to people because you have folks who are providing for their families and they might be hourly workers. And to quarantine is a great economic sacrifice in that situation. But we do need people to do that. So the solution, I think, is to offer some sort of financial incentive, or some people actually call it salary or income replacement, but I generally prefer financial incentive to quarantine at home. And I don't want to get too much on this topic because we have so much to talk about with the commissioner, but if you need to quarantine or isolate folks because either you have a positive test result or you are exposed, the city will provide you food, they'll provide you pharmacy, they will even provide your laundry, and even so much as dog walking, because you can't leave your home for 14 days for any reason other than medical necessity. And so the city will cover you for that. But I don't want to get too much into those weeds. We did have, when we had a question come in, I don't know if that was interference or not, but it's something that I know is on people's minds related to going back to work as we reopen. What about antibody testing? And could this be used as a way to decide who can go back to work safely? I'm going to give you a chance to weigh in a moment if you'd like to, Commissioner, but I just want to offer a little bit of perspective with my health chair hat on, which is that you need to have a lot of caution on antibody testing. We don't understand how immunity works yet. We hope that people with the antibodies, people who have recovered from this virus, have immunity. But we don't know that for sure. And there has been some doubt casted on the question of whether someone could get sick again who's already had the virus. The science is still evolving. And furthermore, antibody tests have a very high rate of false positives. So for those reasons, no one should make a personal medical decision based on an antibody test. No one should stop their social distancing and wearing face masks and hand washing based on that. This doesn't give you superpowers. It doesn't give you magical armor. And therefore, my own belief is that we have to be cautious about using antibody results to decide who can go back to work and who can't. I said a lot there, Commissioner, and I'd be happy to hear your perspective, even if it's different than mine.
No, I mean, so we have been encouraging people to get the antibody testing, but you are right in everything that you just said, right? And employers should not be using that as a basis for denying someone going back to work or not.
Right.
And we haven't tried this yet, as far as I understand, but it's possible they could be considered a form of discrimination.
Yeah.
And so we would like to know if that is happening to people, right? But it should not be used as a tool to decide who goes back to work or who has to stay home.
Right, because you have people who have played by the rules, they have sheltered at home, and they've done their social distancing, and they haven't gotten sick. And for them then to not be able to return to work would really be unfair. And I've actually heard some concern about discrimination on the other end. And I've experienced this a little bit myself, just out in the community, where because I've been sick and I'm fully recovered, I'm fine. People they're wary around you, and I'd be really worried that then employers would, or coworkers, that there would be kind of like a stigma in the workplace of people who've had the virus. And that really is unacceptable. It's not supported by the science. And so it sounds like, Commissioner, you're thinking about both sides of this. We just don't want anyone to be discriminated against because they've had it or not had it. It needs to be fair for everybody. Is that right?
Yes. And I wanted to go back just quickly because I found what I was looking for in terms of the question about someone who has a child or, a minor who cannot go back to school, right, because the schools are closed. What happened is the Congress amended the Family Medical Leave Act to make sure that individuals who have that situation are able to use that benefit. What I don't think, though, is that even though that guarantees that you can keep your employment or you have a right to go back to your job, I don't know that you have to get paid for that time, right? Which can pose, obviously, be a burden for families who need the income.
Right. We have an excellent question I think it's from Elisa Stern, which is, I've heard this from many people. She feels she can work from home. She feels that she can telecommute, that she can do her job from home. What happens if your employer won't let you do that and insists that you come back to work despite potential risks there? How is that resolved? And does the city have a role in resolving that?
So again, the businesses that can open are only the businesses that are the industries under phase one of the state guidelines, right? So if it is a different industry that is not construction or manufacturing or wholesale trade or retail in New York City, and or is an essential business, then that employer should not be calling people to come back to work, right? Now, if it falls within one of those industries, let's say it's manufacturing and it's an administrative job for this factory, right? And it's work that you were doing from home. I mean, unfortunately, I think the employer can make their own staffing decisions at that point, except that what we're saying is that even then employers are going to have to maintain social distancing guidelines within the workplace, right? So that the employee feels safe, the employee has access to, you know, hand sanitizers and hand
Right.
washing. And
Right.
so the employer can say you have to come back to work if it's one of the industries that is allowed to come back to work, right, to reopen. But still has to provide with all those implement all the safety measures for
Right.
workers to feel comfortable.
Right. Look, this is probably not happening a lot right now because of the limited number of industries that are reopening. But in the next phase, when there's going to be a lot of office work resuming, it's going to be a big issue because that's the kind of work that you might be able to do at home, perhaps even you can do at home. And so I think working this out is important. And I think for people who are vulnerable, it's even a bigger concern, perhaps because they have an underlying health condition or because they're older. Is there any accommodation for workers who are vulnerable and need to take extra care when it comes to a decision like going back to work?
So that is a decision that is made on a case-by-case basis, right? Employers have to provide reasonable accommodations to employees under the law if they present certain like disabilities or certain conditions that, you know, prevent them from coming back into an environment that make them vulnerable. But it's not something that is a blanket situation for all, let's say, all workers who have kids, right? All workers who are over the age of 50 or 60, right? So it's very individualized, and employees should be talking to the human resources or to the manager saying, I'd like to request a special accommodation, and then a review will be made on their case, right? That happens even today, right? That happens even today,
right,
beyond like COVID-19 issues.
Yes, it's just going to be right. So I have a question here. It looks like related to this from not sure the name of the question. It might be from I don't want to assume who it's from, but it's about a case in which a worker has a weakened immune system, and that's going to be a major concern in the era of COVID-19. And that, by the way, is not only people who are elderly. You can have someone at any age can have a weakened immune system. There are many, many different medical conditions that can cause that. But I just want to confirm that would be cause to request an accommodation. Is that right, Commissioner, under the ADA?
Yes, they certainly can request a recommendation from the employer, right? Ultimately, it's, you know, the employer will have to make that decision on a case-by-case basis.
Okay, that's good to know. So it looks like we only have time for one or two more questions. I'm going to see what's coming in. While I do that, I want you to say a word about a very important part of your work, which we haven't talked about yet, financial literacy or financial education. And it's always a challenge to manage your money, to manage your savings, to manage your banking needs, to manage your investments or retirement planning. But gosh, in the middle of an economic depression, even more so. Could you tell us what kind of help you offer to people who need to navigate that? And also, it's still tax season because the deadline was extended, I believe, to July 15th. And I think it's your agency that can help folks who need assistance in preparing their taxes?
Yes, absolutely. So we do have an Office of Financial Empowerment that has been working with community providers in different neighborhoods across New York City to provide free financial counseling, professional, confidential, one-on-one counseling in the language that you speak for any New Yorker who's over the age of 18. And even before the COVID-19 crisis, people would come to meet with a counselor and get help with everything from like just creating a budget for the first time to going over their credit reports and correcting any errors in them, working towards improving credit scores, and even tackling their debt. So our financial counselors will get on the phone and negotiate with your creditors to get you a better deal to try to
That's incredible. That's incredible.
In fact, I just heard 2 weeks ago, a financial counselor was saying to me that, you know, because of the crisis, a lot of these companies are just willing to settle for any amount of money right now. Well, before I could get a consumer a reduction of like 30% on their debt, I'm getting reductions of up to 70% of their debt. So that's one thing that counselors are busy doing. They've been trained to know all of the most recent federal like relief in terms of student loan debt payments, right? Even the economic stimulus checks. The counselors are really a great source, as a trusted and safe source to go to if you need help with that, right?
Right.
Don't pay anyone to do this work for you. Come to a financial coach, call 311. Right now, our counselors are doing all of this work remotely via telephone and via video conference, but they're using safe virtual platforms. Similarly, with the free tax preparation work, right? We have until July 15th, as you said, and families that earned $64,000 or less last year qualify to do their taxes completely for free with one of these tax preparers. They do need to have access to a computer or a tablet because all of the work is being done virtually. But I encourage people to use these services because our trained tax preparers will never ask you for a cent, right? And all they do is try to get you as much money as you are eligible for, all the tax credits you can get.
Got it. I think we have time for maybe one more final question from Evelyn Suero, who has an accommodation for an ergonomic chair, which I think is quite common. But she's working from home. And it raises a great question. Would the employer not be required to provide an ergonomic chair for work at home? I would think they would. It's the same challenge, no? Or
so,
what's the answer on that?
Yeah, no. I mean, that is a really great question. And to be honest, it's like this is a new world for all of us, right? Working from home. And I do believe that a special accommodation would still be required even if you're working from home. So I think you can request it, right? But I think it's a challenge right now because I think employers will definitely have it won't be easy for them to comply with all of those rules if they have to provide that to every single worker. But if you already had an accommodation, you should ask for it.
It sounds like Evelyn has been in quite a battle, and she appears to work for a city agency. This probably warrants a little more one-on-one attention. So she perhaps someone on your staff could connect to her. She's posting in the chat right now. And our hour has flown by, Commissioner, because there were so many good questions and so much to talk about. And I'm just so grateful that you took time to answer all these important questions and concerns, which are even more challenging in this era of coronavirus, an era which I'm sorry to say is not over yet. We have made progress in beating back this terrible disease, but until there's a vaccine, folks, we're not going to be back to normal. And the questions you're asking today are still going to be relevant. But to know all the assistance that your agency, which is now, if I'm not mistaken, the Department of Consumer and Worker Protection, offers, it's really incredibly encouraging. So, una vez más, comisionada, le quiero agradecer por haber participado en esta excelente charla y por todos los servicios que están brindando a la comunidad durante esta dificilísima pandemia. Así que, una vez más, gracias. Thank you again. Would you like to offer any parting words, please?
Just thank you for the opportunity, and you're absolutely right. This is not the time to relax. It's the time to continue to do the good work we've been doing to defeat this virus. So don't relax. Keep up the good work, everyone. Muchas gracias, y de nuevo que todos sigamos luchando con esto. No hay que relajarse mucho porque todavía no hemos vencido esta enfermedad. Y esperamos, y aquí estamos para cualquier otra pregunta y alguna otra visita de nuevo, otra oportunidad. Gracias.
Excelente, gracias. Thank you to everyone who participated on Zoom, on Facebook. It's been wonderful to have you. We'll be back again soon with another exciting conversation. Thanks for joining us. Be safe, everybody. Bye-bye.
Bye, everyone. Bye.